what I take from this wonderful presentation of how tremendous progress was made in San Antonio is that there are three things that we need to make our mental health system work, to make our criminal justice system work, and to keep mentally ill people out of the criminal justice system. Those things are money, leadership, and cooperation. Sometimes we have those things, and sometimes we don't. It is my view, it's easy to speak to this crowd about this, and after this presentation, I take it, it won't be hard to say this. In my view, the highest priority for people in the mental health system should be the struggle to keep mentally ill people out of the criminal justice system, to keep them out of the criminal justice system, prevent them from going into the criminal justice system when they get out, do what is necessary to prevent them from going back. I think that argument can be made without any further words if you watched and listened to Leon. And many of you know many of the details. I'll just point out a few things about Illinois. I mean, we have between 8,000 and 9,000 people with mental illnesses in the Illinois Department of Corrections. We have at least 2,000 in our Cook County Jail, probably more, and probably another 500 at least in the other 98 county jails in this state. Those are just numbers. It is my view that the worst outcome for people with mental illnesses is to be in prisons and jails. It is almost impossible, despite the efforts of many dedicated people, some of whom I consider my friends, to deliver decent, humane, and safe services to people with serious mental illnesses in prisons. It's a very difficult job. Prisons are difficult environments. They're difficult environments for everybody. They are most difficult for people who are vulnerable, and particularly who have untreated mental illnesses. So that's the humane side. Then the money side. Our prisons are in the middle of settling a huge class action about the failure to deliver decent and humane mental health services. That is, the state prison system is in the middle of that class action. It's costing the state an arm and a leg to fix things, and all they are going to do, you can't blame them, is bring the level of mental health services up to the minimal constitutional level. That's not very high. It's not very high. That's not what we would want for people we care about. And we're spending a huge amount of money doing that. Our Cook County Jail has been sued, depending upon how you count each of the suits, so many times, but certainly two big class actions focused on the failure to deliver adequate and humane mental health services, again, costing our county taxpayers a heck of a lot of money, which, as you can see, we could save. So I think this should be the highest priority for community mental health providers, for our mental health system, for all of the people who are in the mental health system, should be saying, what are we doing to fix things? So let's go on to the three things that I think we need. Money, leadership, and cooperation. We are lucky that we are one of the 27 states that decided to expand Medicaid under the Affordable Care Act. That is going to make a big difference. I'm not going to talk about that because one of the things I've learned is when you're on a panel, don't talk about a topic when there's someone on the panel who knows more about it. And you will hear from that someone very soon. Let's just say this is a no-brainer. We all of a sudden have a huge infusion of new money into the healthcare system. And I'm, as someone who's now become very old in this business, I failed to fix the mental health system over 35 years, and I promise to continue to fail, so that maybe I'll get invited back. All of a sudden, we have this huge infusion of new money. It's the Affordable Care Act for people with mental illnesses in those states that have chosen to expand Medicaid is the best thing that has happened to the mental health system in my lifetime. And I am 65 years old. So that's a big opportunity, and we cannot afford to waste it. I'll say a few words about that in a minute. As was suggested, part of the problem about money is the money is diffusely spent, and the benefits of fixing parts of the mental health system often go to other people. And That's not how things work very well. So if I fix the mental health system and the benefits go to the Department of Corrections, they're not going to send me their money. And the question is whether we can help them figure out that perhaps they should. Perhaps they should. Say a few other words about the money system. We have used in Illinois and across the country a variety of innovative methods to reduce the number of people with mental illnesses in the criminal justice system. Mostly in Illinois, unfortunately, we have done these as relatively small experiments, not as system-wide efforts. And the problem is that those things are expensive. And if you're going to make any of these interventions work, as was suggested by the wonderful data that we just saw, what makes any new program sustainable is that it saves money, and that money can be dedicated to sustainably pay for the new services. So the only way we're going to have ongoing mental health courts, diversion courts, the only way we can have a program like the wonderful one you saw from San Antonio is if in fact, it reduces the population in our jail. So that means that everyone has to come together and say, okay, now we're going to take whether it's 9,000 or 10,000 people we have in the jail today, and we're going to bring that number dramatically lower, and that money is a sustainable source of money for all of the services that we need to provide. Now that requires leadership, as Leon said. We are lucky to have had leaders like that in Illinois, and one of them is sitting in the room, Judge Biebel. We wouldn't have a mental health court, or mental health courts, plural, many of them in this county, but for Judge Biebel. I'm not taking credit away from all the other people that he brought together, but he brought them together. Just as Leon described what happened in San Antonio, that's what happened in Cook County. We can look just a few miles down the road to Winnebago County, where then Chief Judge Kathy Zinoff, who's now an appellate court justice, brought people together, again, with lots of other folks who I consider my friends, worked with now Justice Zinoff to make this happen. But it would not have happened had not a powerful judge said, this is my priority, this is a stupid system, we must work together to fix it. And so we must support that. What we have not had in this state, and this is not a partisan statement, we have not had this. I'm old, so I've lived through many governors. Many governors. I can remember when this state was a solidly red state, and everyone in state government was Republican. That's not true this moment. We now are a purple state for a while, you know. Under numerous administrations, we have not had statewide leadership in the mental health field. That is, no one's in charge. No one's in charge of saying, okay, I'm going to make our Medicaid agency devise its funding streams so that it pays for the stuff that we need in the mental health field. And notice that in every state, including Illinois, and more so with the Affordable Care Act and Medicaid expansion, Medicaid is the largest single source of funding for mental health services. So if you don't spend your Medicaid money in a smart way for mental health services, you get the problems that we see in Illinois. So we do have to figure out strategies to create leadership, to work together and say, okay, now when we save all this money by emptying out our jail, which it seems to me is a key measure of whether we've done this right. If 10 years from now the jail still has 9,000 or 10,000 people in it, we should announce to ourselves that we have completely failed. We have completely failed. And our answer has to be that we are getting people out and then making sure that they get appropriate services in the community. The good news is there are lots of people working on this, and thankfully lots of them are in the room and can tell you more about what they're doing. We are working on projects, and I know people in county government and city government and state government are working on this. The problem still is that we haven't figured out how to do all of these things together, and that's what we need to do, is to figure out how we can do these things together so that when I save money over here, I share it with the other people who benefit from, who have spent money to help me save that money. So money, leadership, cooperation, that's what worked in San Antonio. When we have that in Illinois, I can finally retire.
So good afternoon, everyone. It's a privilege to be here with you all today. Many colleagues and friends on the panel and many more in the room. So there's a lot of power and there's a lot of promise in this room. So I think if anybody's going to get stuff done, it's going to be the folks in this room. Again, my name is Mark, the other Mark, Ishaug. I will always be the other Mark in Chicago in this space to Mark Heyrman. What he has done in the last 35 years for people living with mental illness is really extraordinary, super extraordinary, and I could never recount everything that he's done. So for him to say that he has done nothing in 35 years and has to live another 35 years to get something done, he's lying. It's, the system has been transformed because of you, Mark, and your leadership. So I want to thank you again. I'm very proud to be the other Mark. We're one of the other Marks in this space. So for those of you that don't know Thresholds, we have been around since 1959, and we have provided home, health, and hope to those with serious and persistent mental illness specifically, and other very complicated challenges, none more than the challenge of homelessness, but also serving folks with histories of trauma, incarceration, and other institutionalization. So thank you, Ed, for inviting me. I am no Jerry Dinson either, but also proud to follow in his footsteps. And I want to thank Leon especially for joining us today from San Antonio. I had the privilege of being in San Antonio on Monday with my friend Maureen McDonnell from TASC here in the front row, and my colleague from Thresholds who oversees all of our justice programs, Peggy Flaherty, where we visited the Restoration Center and spent a day there in San Antonio. And all I can say is, wow, the videos and his presentation, as good as they are, they do not describe what that Restoration Center is when you are in the space and in with the patients and in with the colleagues and in with the police. We met them all. It was inspiring, and we can and we must replicate it now. So that's my first charge. We have to figure out how to build the Restoration Center. It's not the answer to our problems here, but it is part of the solution. And so that's one takeaway. Cook County, as you heard from others, is bursting at the seams, not only with inmates in general, but some 2,800 persons a year who are also struggling with serious mental illnesses. According to the research that we've done, that's 3 times the number of persons with mental illness that passed through the jail just 4 years ago. So this is a major problem that's gotten 3 times as bad in the last 4 years. Meanwhile, in San Antonio, as you saw and heard, there are hundreds of spots, now 1,000 spots, or at least hundreds of spots in the county jail that are sitting empty. And this happened in less than a decade after that jail suffered from major overcrowding. People are getting treatment and staying in their communities, and Leon and your team, you have shown us part of the way that we are going to fix our problem in Illinois, and we will. So I'm going to start out with this. So thank you. Yes. Oh, well, I haven't got anything done yet, but you can clap in advance. So I'm going to tell you a story about Joe. Joe's 54. He's a Thresholds client. Probably 2 of my colleagues know Joe very well. At least one of them probably knows Joe very well. He was diagnosed with schizophrenia at a very young age, like many people we know that are diagnosed at 19, 20, 21. And he spent his entire adult life, so diagnosed early at a teen, 54 now, spent his entire life in and out of jail, homelessness, nursing homes. He was arrested so many times for nonviolent behaviors associated with his untreated mental illness. But he came to Thresholds on a referral from a social work staff at Cermak Health Services. Anybody from Cermak here today? Oh no, that's too bad. The greatest folks on earth working at Cermak. So he was due to be released earlier this year, I think in January, to no home, no services, no treatment lined up before he left. And we all know that given the situation, Joe would have ended up back in jail probably in weeks, if not days. But Threshold's coordinated with the CIRMAC social workers, the jail, adult mental health probation, before his release. And we worked with our housing team at Thresholds to secure housing. When he was released, we accompanied Joe to his new home. We made sure that he had food in the fridge, medications, clothing. We were talking about clothing at lunch today. How many people are released in December with shorts and flip-flops? Because that's what they came in August with, and that's what they're released with. We made sure that he had clothing, public benefits, and everything else he needed to start his life over. We now meet with him 5 times a day, 5 times a day, God, 5 times a week. Even 5 times a week is a lot, but that's what he needs, and that's why we meet with him 5 times a week in his home or in the community. He's connected to mental health and physical health care, and he's now working with our supported employment team because he is employable and he will find work. We met with his father recently, who said that he was scared that Joe was going to die outside in the cold because he didn't have a place to go after jail. Jail was his home. Instead, Joe's doing really well. He's been in our care for about a year, and he has not been arrested once in the past year. That's what's possible. We have so many stories like this. I'm not going to have too many statistics in my short presentation here, but in the last couple years, we've been looking at data for the last 3 years now. On average, about 4% of folks that are in Threshold's care are booked and arrested. 4%. When you look at the total population, and when we compared people that we had a light touch with, 1 touch on an outreach visit, 1 touch in an ER where we're not able to provide continuous services, booking and arrest rates are between 25 and 32%. It's exactly the percentage that you described in one of your counties, where 30% of the people are in and out of jail. But when folks are in continuous care, and including the kind of case management that we and Trilogy and our partners offer, we have recidivism rates of about 4%. That's almost unheard of. So this story is possible, and it can be replicated again and again, but it requires a few simple things: an investment in treatment and services, access to affordable housing, and seamless coordination between all the providers and systems that were talked about this morning. Health providers like us, healthcare systems, law enforcement, courts, jails, and the prisons. All of us need to be on the same page for Joe's story to happen and happen again. It's really that continuous chain that everybody described that's so critical. It's about sharing cost and sharing savings, and it's about having the will and the foresight to invest, to save lives, and to save money. And it's about all of us working together, which was also the theme of the Kennedy Forum of Illinois yesterday. Some of you were able to participate in that really seminal event. Thanks to Peter O'Brien and Mark Meraz in the back and many people in this room. We pulled off something yesterday by bringing together, almost 800 people in the afternoon and the evening, non-usual suspects, to figure out how we're going to work together to serve people with mental illness better than we are today. And it's really inspiring to think that there's corporate and civic leaders that really want to get involved in this fight. So it really is about all of us, systems, individuals, people with lived experience, and mostly the unusual, that's not the right word, the non-usual suspects, who may be unusual too, but really getting the non-usual suspects involved in our fight. We can do this in Illinois. I know we can. You're going to hear a little while from Maureen. It's really about Medicaid expansion. We have a lot of the right links. We have a lot of the right partners. We need to do so much more in creating a seamless, unfractured system of care, because that's what's killing us and killing our clients. You know, it costs about $30,000 to $70,000 a year for these high-cost institutional settings, jails, nursing homes, such expensive ways to treat people. And for $20,000, we can treat somebody with housing for a year, safe, supported housing, and high-quality services, including intensive case management, for on average about $20,000 a year. So we know this can be done. And we have a couple of roadmaps for this. One that you may be familiar with are the Williams and Colbert consent decrees, where we have moved and our partners have moved maybe 1,000 people safely and securely out of nursing homes to community settings, really for a fraction of the cost of what it was costing. And with that comes housing and peer support, linkages to health and physical health services, and most importantly, rental subsidies, because none of it can be done without housing. So it's working in the Williams and Colbert consent decrees. It's working in a new system that we're developing. And again, Peter and Mark are taking the lead with some of their colleagues, specialized mental health rehab facilities. Some people call them repurposed IMDs. They are reinventing themselves to be transitional and short-term, recovery-oriented, to help us more quickly move people to the community into integrated settings where they can live exactly how we all want to live in integrated settings. And we're also looking at SMRF comparable programs where community providers like Trilogy and C4 and Thresholds and HRDI and many others are working directly with nursing homes and hospitals to move people into the community safely and effectively. So I want to talk just for a few seconds about some diversion programs, because I totally agree with you, Mark. The most important thing is we can keep people out of jail, right? That is our job. And with community mental health services, we can keep people out of jail. So I just want to talk for a second about our work with the Chicago Police Department. I see several officers here. Thank you for your service to our city, and thank you for your service to our members. CIT, which you heard about, we've been involved in this program for about a decade. I wish somebody from NAMI were here, because NAMI's really taking the lead locally, and there's such great... Oh, hey, NAMI, sorry. I'm sorry, I'm always looking for Alexa, but nice to see you, Moshe. Welcome. But really, NAMI has been an extraordinary leader in this space locally and nationally, so we're so grateful to you. But our staff and our members, in fact, people living with mental illness consult. As you know, you're shaking your heads and providing consultation and role-playing and scenarios that are helping officers handle situations where people are experiencing mental health crisis. And it's really the difference between life and death, jail or thresholds, a community mental health provider like Trilogy, or a hospital or ER. We don't have to go to these places. And thanks to you all, and a really exciting new grant that we just got with the Chicago Police Department and the Council of State's Justice Center. I hope you guys know about it. We're going to be training an additional 650 officers to increase the number of CIT officers on the force by over 30% in the next couple of years, which is really exciting. We also raised some money to do research and evaluation to determine whether and how this is working and to create the maximum impact and effectiveness. So huge, great hats off to NAMI and to the police department. We have to take CIT to the next level here. So what else do I want to talk about for just a few seconds? So even if an individual isn't arrested during a mental health crisis, the other challenge we have here is that we're taking too many people to emergency rooms. One of our emergency room partners told us just recently that they're getting an average of 10 mental health admissions per day. I mean, and this is not where the folks belong, right? We know it. They belong at Restoration Center, and they belong in our care. The emergency rooms are not the place, but we're dropping them off there over and over and over again. So I'm going to end with three sort of calls to action. Let me see, just so I can take some time here. So first, but I want to talk just for a second about a very promising practice. Thanks to the Cook County Board, and to President Preckwinkle and Rebecca, she's still here. We're doing a pilot project in Bond Court right now where we have 2 full-time social workers, clinicians that are working to identify those with mental illness who are going to be released on I-bonds or electronic monitoring. And we're coordinating the care. We're meeting them right where they're at and developing a relationship so that we can provide them services seamlessly, hopefully right there when they get bonded out, or if they're in jail for a few months, that we've developed that relationship so that we can serve them when they're out. We have the expertise. Many of our colleagues in the room have the expertise. This is a really critical moment, and we have to seize it. So the second thing I want to talk about after investment in treatment, because it's really all about investment in treatment and early intervention. The Affordable Care Act is the game changer for us. Hundreds of thousands of people are going to have access to insurance they didn't have before. If we can invest in people now with these new dollars, with the managed care companies, we don't have to wait until people are very, very sick and disabled. We can treat them early, we can get them the services they need, and we can keep them healthy out of jail and out of nursing homes. And it really all comes down to housing. This is the biggest missing link in our system. We have to figure out how to raise money for rental subsidies, and we have to figure out alternative ways to fund housing, be it through social impact investments, pay for performance, private sector investment. We cannot only turn to the government, thank you, to do this, but we have to figure out other ways to provide housing. And like Mark Heyrman said, collaboration. This is the key to our success.
Well, thank you, Ed, and thank you, Art, for and Mark for inviting, and for all of you for sticking with this conversation on a Friday afternoon. It was snowing. I felt like I was in a snow globe earlier today, and I was like, okay, I'm so not ready for this. So there was part of me that just wanted to go home right then. And I'm glad I didn't, because I did, as Leon noted, Mark and I and Peggy had the opportunity to actually visit the Center for Healthcare Services and see the Restoration Center and kind of how all this works earlier this week. But Leon was out of town, so I wouldn't have gotten to meet him if I'd gone home. And it's great to hear you tell the story about how all this came together. And I don't think, I would be surprised if there's anyone in the room who doesn't sort of share the notion that keeping people out of jail is better. And also recognize that our infrastructure in Illinois has what was never robust in the community side for mental health treatment was absolutely decimated 6 years ago with enormous budget cuts, and we have not recovered from that. And so the big light at the end of our tunnel, the one that we're all sort of in the middle of trying to figure out right now, has to do with the Affordable Care Act and what do we do with that? And how do we take what is in theory a very large potential revenue stream and actually make it into services for people that keep them safe and healthy in the community and out of the jail. And so, I think it is very striking, when we were in Texas, when we were at your place, to think about that you did this without the benefit of the Affordable Care Act, before the Affordable Care Act was even really on the table for consideration. So I think it's important to not only focus on the Affordable Care Act, but others on the panel have talked about the importance of diversion. My job is to say a little bit about the Affordable Care Act and what we're doing with it in the justice system, so I'm just going to get down to business on that. So a very brief 5-sentence refresher on the Affordable Care Act for those of you who don't think about this every day. As you know, it's an enormous law. It does a million things. It's had lots of problems, political, practical, you name it. But the part that matters the most to the justice system is simply the expansion of coverage for low-income adults and our ability now to enroll, help people who have never really, in our adult working lives, been eligible for health care coverage of their own, to get that coverage and use that coverage on behalf of their own health. And so for a single adult, if you're below about $14,000 of annual income and you live in the state of Illinois, you don't have to be disabled, you don't have to have children that you're taking care of, you don't have to have any of the things that we're used to, and you can get your own health care coverage. You have to figure out how to apply for it, and there are many people to help with that. But that is the sea change. And so it was actually in a conversation with Judge Biebel back in the fall of 2011 that we sort of figured out how to frame this in the justice system. And that is that let's dial back to like 2010. Before the Affordable Care Act, we had maybe 1 in 10 of people who were entering the jail and people who appeared in front of judges had any coverage of their own, any access to health insurance. They might have had veterans benefits. There were some folks who had Medicaid based on disability, and some, a small number, but some who had insurance through a job, probably didn't have good behavioral health benefits, but that's neither here nor there for this story. And then as we see all of this roll out across county, across states that have opted to do Medicaid expansion, we're looking at more like 9 out of 10 of the people who appear in front of judges and people who enter the jail who are eligible for coverage. And so under the leadership of Judge Biebel, who was very, I think, interested in what we might make of this for his judges, but also very willing to say, well, we should get together and talk about this. And I won't speak for him because he's here. I'll let him speak about it himself if he would like to during the discussion period. But under his leadership, we were able to bring together leaders from all the Cook County justice agencies, the sheriff's office, the judiciary, probation. I'm going to leave somebody out, and I apologize already for doing that. And the Cook County Health and Hospital System, and we have some health system folks with us today, as well as foundations, community foundations that have seen the potential in this time and want to help us figure out how to really capitalize on this moment. And so the justice system, so it was kind of funny, at our first meetings, all the people from the justice agencies sat on one side and all the people from the health agencies sat on the other, and we didn't have any common language, right? Nobody knew how to speak Medicaid on the justice side, and nobody knew how to speak justice on the health side. Well, I can tell you, after 2 years of meeting, that is no longer the case. And we had a recent meeting in August where we were talking about what our goals should be for the next 12 to 18 months. And I'm trying to facilitate this meeting, and I couldn't get a word in edgewise. It was so robust, and it was a wonderful, I think, signal of where we are in this process and that we just keep digging deeper into what we can do. So we figured out a couple of things one is about that the justice system can actually help everyone who's eligible get covered, whether it's at jail intake or whether it's in probation supervision or whether it's when they're with a program like TASC or whether they're in treatment with an organization like Thresholds, that people can get covered. And it's sort of amazing because 2 years ago, we were all like, I don't know how we're going to do that. But now it's like, oh yeah, we know how to do that. And so we've bitten off the second piece, which is how do we help people link to services? And so we have a project that's funded through the Illinois Criminal Justice Information Authority, and Mary Ann Dyer's here from Adult Redeploy, which is the access to community treatment court that the courts took on and said, we want to do our part of this, and figured out how to do a prison diversion court project using the resources of the Affordable Care Act. So we had to figure out everything like how people get covered and how people access care through a managed care plan, and how is it different? What is different? Because the basic values are the same, and the basic processes are the same, but it's all about figuring out how the money works and how the services work differently. That is sort of our new challenge. And so we're well along on that. There is also a new project working with people leaving the jail that is a healthcare linkage project as opposed to a comprehensive reentry project. And that comes to us with funding from the Michael Reese Health Trust. Thank you, Elizabeth. And with extensive partnership with the Sheriff's Office and with the Cook County Health and Hospital System to figure out how to make those linkages at release makes sense. As most of you know, people leave jail, they may have been there a day, they may have been there for a year, and everything in between. And so people are more or less prepared, depending on how long they've been there, to be able to leave in safe circumstances. And so, we're working out all of those pathways as well. And 2 years into this, we have some infrastructure to show for it, but it is ultimately, it's the expansion of treatment capacity in the community that will be the success or failure of these efforts. The justice system can change what it does and how it does certain things, but it is all about treatment. And preventing detention is all about community capacity. So whether we're focusing on treatment and linkages for people who are already in the system, or whether we're focusing on treatment and linkages for people who don't need to go into detention and supervision and so forth, it's in the end all about the same part. And so I just want to share with you a little bit about the part of that work that is part of the Justice and Health Initiative. We have a working group of community providers, substance abuse and mental health providers with long-standing commitments to serving people under justice supervision. And we've come together, I think, maybe 6 or 7 times in 2 years in Judge Biebel's courtroom to talk about this. And the first meeting of that group was very striking to me. We had, met ahead of time and talked about what we wanted to accomplish and so forth. But it was the way Judge Biebel led that meeting that kind of blew me away, because he actually asked, there were probably 40 or 50 people in the room. He asked every single person in the room to go around and introduce themselves and talk about why they were there and how they got started in the field and why this mattered. And it was, I think, in that sort of process of knitting the group that resulted in the group sort of knitting together as a whole in a really important way and deciding to take on this time together. We're still at it. We have not solved all of the problems of how to access care and how to access more care. But it is in figuring this part out. How do we draw down this potential resource chain and make it actually create more care for the most vulnerable people, that we will either make a difference or say, oh yeah, we kind of missed that. And I don't want to be on the second part. I want us to figure it out. For me, the most important things that we can do in creating the capacity for people to prevent detention, for people to stay in safe care in the community without having to go to jail as the only alternative, is first of all to decide that we want to. We all have a million things to do. It was hard to just get time to come here, I'm sure, for most of us. And it is hard to take on a big new thing. But also, why not take on a big new thing? If it's actually going to mean the difference for hundreds of thousands of people every year, why not do it? I know I want to, and I know we're all looking for partners, people who want to do it with us. There are very practical things that we need. We need, if to do something like the Restoration Center, we need space. Space is at a premium in Illinois. Zoning makes many things very challenging. Community opposition to certain kinds of projects makes things challenging, but we need workable space. And there is probably among all of us access to decommissioned healthcare space or some other spaces like this that actually could be viable to do what we are seeing, what Leon has showed us is possible. We need partners on the funding stream side, both the managed care side and the Medicaid side, who can help us figure out how to braid the funding together. There's a lot of very detailed work in how Medicaid works, and we need people who are smarter, certainly, than I am about Medicaid to be able to help us know how to do that. And the most important thing in the end is community providers expanding their capacity, because we don't want to just create another crisis center. Great that it's not a jail or a hospital, but if people are just cycling through a crisis stabilization center, we haven't really made the progress that we're looking for. And so putting that plan in motion requires a group to take ownership of it, and I'm hoping that some folks in this room will decide today that you want to join us.
I appreciate your attendance this afternoon at this event. This has been my hobby horse for 35 plus years. Just fortuitously, I came upon work in the criminal justice system, setting out initially to be a clinical psychologist in the state hospital system and Chicago Community Mental Health Center. I worked in both arena and had an epiphany. It was probably after a rather frustrating day of working with clients and regarding myself as being wholly feckless and just inept in trying to help them. I don't know if I was or not. I think I was, as a young therapist, focused a little bit too much this way because of my self-consciousness. But I had an epiphany, and here's my epiphany is, I love research and I love statistics, and I think if I can study what really helps people and collect data that could build new and innovative programming instead of meeting with 5 or 6 a day, maybe eventually the programs that I study and by virtue of the data I collect help design, I can help thousands of people. So I kind of got out of the business as a service provider and became a university professor and had great training at Northwestern University, not only in the psychology department, but most critically in the Center for Urban Affairs and Policy Research, the Institute for Policy Research, is where I learned about the criminal justice system. I am a professor of criminal justice and criminology, not as good as Dr. Olson is, but I learned about the system by working in it rather than studying it in a formal classroom. My classroom was the court system. My classroom was the jail. My classroom was the probation department, the state's attorney's office, the public defender's office. And because I'm a dyed-in-the-wool psychologist, I tried to infuse psychology into everything that I do and still try to do that. That's my first love. And I had the good fortune of meeting Linda Teplin when I was a graduate student. She still refers to me as a kid. God bless her. Because I'm an old fogey now, as Maureen would tell you, because she knew me when I was somewhat young. Well, Dr. Teplin educated me a lot about the research she was doing on criminalization. This is the early 1980s. And my first book chapter was in a book that she edited. It was a gift from Linda Teplin to me. And I appreciated her wisdom, and I mostly appreciated her methodological rigor. Every study that she designed was top flight with regard to methodology employed and statistical analyses, and also conceptual frameworking, which is really hard. She did it really well. I'm not giving my presentation because it's over. The event's over. So I'm gonna tell you what I was thinking while people were talking, and they were saying really smart things, every one of you, and you were just an inspiration to me, Mr. Evans. I'm so happy you're here. Sorry about the weather. I had the Jesuits praying for better weather today. And
Not well insulated, so it's fine.
thank you so much for being here. The work that you've done has been truly awe-inspiring to me. And you know why your work is so good? Because of you being able to talk to people in the right way, to leverage resources and political currency, to bring the right people together. And you know what you also did? You're implementing evidence-based practices. Thank you very much. They work. He and others who spoke today, my elbow did that. It's being at this Jesuit school, I'm empowered with many things, including changing PowerPoint presentations with my elbow. Enough about the Jesuits. I'm talking about them only because Judge Biebel, he's deep down, he was the Jesuit guy. All right, Georgetown Law School, Judge. We were talking today, and I'm very pleased that we were, mostly about the criminalization of the mentally ill. Criminalization occurs when people are arrested, sometimes prosecuted, convicted, and punished for simply manifesting the signs and symptoms of mental illness. Their intent was not criminal. They could not control their behaviors because they're a product of brain disease. I say we should eventually stop criminalizing people with mental illness. The latest research suggests that perhaps 4% of people who enter the criminal justice system are entering because of criminalization. Criminalization does not occur when people with mental illness commit serious crimes and are arrested and prosecuted and convicted. That is not an instance of criminalization. I think we should have zero tolerance for criminalization. We need to do everything we can, and it has to be upstream to keep people from mental illness entering the criminal justice system, being arrested and going to jail simply because they were symptomatic in public. And it was scary to people. And so what do people do when they're afraid? They call the police. So we can't not be mindful of the need to continue to concentrate our efforts upstream in a variety of diversionary programming that keeps people out of jail. We need the wonderful police sergeant and officers in CIT to continue to deflect and divert. We need more of you, more of you. We need you everywhere in the city. We need more police officers who are trained about how to approach a person with mental illness. So they have to be, and they are, the officers who work in Chicago, the ultimate de-escalators, I call them. They're able to respond to people with mental illness in a manner that does not result in the encounter then becoming a criminal incident because there's an assault on a police officer or other crimes for which they are no longer being criminalized because they're felonious acts. When I hear about people with mental illness in the criminal justice system, I don't know who they are because people with mental illness are a heterogeneous group. They are varied individuals with varying services needs, varying diagnoses and psychiatric histories, as well as varying degrees of criminogenic risk. The risk of being arrested, the risk of recidivating. That makes our work very complicated. What's most important is that we target our intervention and programming to meet those complicated needs of people with mental illness in the criminal justice system. There are, I have to teach DSM-5, I'm not ready yet, but there's 300 plus diagnoses there, and they're all called mental illness. We have to, I think, do a much better job at assessing people's psychiatric problems so that we can better respond to their psychiatric needs should they touch the criminal justice system at one of those interception points. So they are people with multiple morbidities. They have a passel of problems, and therefore they need a barrel of services, comprehensive, well integrated, and it's been my focus lately, they have to be trauma focused. Mark, you said something I've been saying a long time. Thanks for saying it again and again. We need housing for people with mental illness who are involved in the criminal justice system. And when your predecessor opened up his wallet and was very generous in funding a program that helped transition people from the front gate of the jail to a place to live and threshold services, I was the evaluator. I had the privilege of studying that program. You were with me there. And what we found is, what we find today is that when you do provide people with the wealth of services they need, including a stable place to live and someone to ensure compliance with their medication, they don't go back to jail. That's what I did my research in 2000, 2001, early aughts. They don't go back to jail if they have all of those services. Let's not forget, Maureen, tell us about the high rates of co-occurring disorder, comorbidity. People with severe mental illness usually have substance use disorders and addictions, and they each complicate the other and make recovery from addiction and other psychiatric disorders more challenging. What's really challenging for me is getting people with severe mental illness to adhere to their medications. Many of them do not have insight, and therefore, if they don't view themselves as having a brain disorder, they're less likely to comply with medications and more likely to use drugs or alcohol to make themselves feel better. And so we have to make sure that we have fully integrated care that addresses the full panoply of services that people need for a wide range of conditions. Judge Biebel, I was so happy when you invited me to the table. A long time ago, we were together with Maureen and Pam Rodriguez of TASC and a variety of other principal actors in the criminal justice system to talk about mental health court. Thank you, Your Honor, for that privilege. This is a program that is post-adjudication. And so we need to also bolster our efforts there. Mr. Evans is doing is incredible to keep people out. But we also know that there are large numbers of people we could not have kept out because of the kinds of criminal activity they were involved with. It's critical that we treat their psychiatric needs, we treat their addiction, but we also respond to their unmet criminogenic needs so that they are able to change their life trajectories and not be involved in continued criminal activity so they can stay out of the system. So think about the enormous challenges these folks bring to us. They don't just have types of psychiatric illnesses. They have co-occurring substance use and addictions, also a type of psychiatric illness. They have housing problems. They are undereducated. They are unemployed, unemployable sometimes. They don't have stable living environments. They have a tissue, paper-thin social network of people who are going to look after their better and best interests and make sure that they're living safe and stable lives. This is a challenging group. And because of the work of people here and the leadership of Judge Biebel, we have made tremendous inroads in Cook County in responding to the needs of people who have severe mental illness and are also involved in the criminal justice system. I'm very proud of the work that we've done, but there's always more work. Here's the shortfall. There are a couple. The major one is underfunded mental health and addiction services. That's it. I mean, grossly underfunded. I mean, Illinois 49th in the United States in funding mental health and addiction services. You know, the problem in part is we are woefully uninformed about the needs of people with brain disorders. And Dr. Watson, tell me about it. She's a leading researcher on the stigmatization of the mentally ill, which in part plays a role in part in mental health services being woefully underfunded, mentally ill people being marginalized, misunderstood, and criminalized. We need to have better understandings about what mental illness is and how it adversely affects people's lives and their families' lives. And one of the changing life experiences that I had is that I lost my very best friend to major mental illness. He's still living, but he's gone to me and to his family. Because this is a extremely talented, extremely good-looking young man with extreme skills. He was an artist, and then he's gone at age 18. You know, most severe mental illnesses have age of onset in late adolescent, emerging adulthood. Think about all of the years that he has lost, that he hasn't been able to partake fully in life because of his brain disease. And it was one of the experiences in my life that inspired me and made me feel compelled to try to do something about it. And all of you in this room share my passion, share my interest, and you do things for people with brain diseases that are different but complementary. It's the complementarity that we have in this room that's going to make us so successful.
The Illinois Academy of Criminology. Everything we do is recorded in annals. Our archivist was Gad Bensinger. Some of you knew him. He was a professor here at Loyola. And these are some of the annals. They're in the Library of Congress and various college libraries, University of Michigan, and so on. This program will be up on YouTube, distilled down to the essence. Everyone's attention span is shortened. So it won't be on YouTube as long as it was here. Here's our group of some of our past presidents, academics. One is a true crime writer. We're giving an award to William Bratton, who you know is the police chief in New York, and he was in Los Angeles. We wanted to reward excellence in police administration. And we chose him for the O.W. Wilson Award, which we created. And you can see the diversity of our group. So I want to thank you for your attention. It's remarkable to have people sit and listen this long. Thank you very much. Bye-bye.